Good afternoon, everybody. We are Group 4 of Introduction to Nursing Theory class of George Brown College, and we are here to present our theory, The 21 Nursing Problems by Feiglin Abdallah. My name is Janina Ferranda, and I'm here to tell you who is Feiglin Abdallah. Feiglin Abdallah is a leader in the development of nursing research, a leader in development of nursing profession within the public health service. She also developed the patient assessment of care evaluation, which is being used right now in most of the hospitals in the United States. And she also wrote the book Patient-Centered Approaches to Nursing, which focuses on the science of nursing and has helped in the development of nursing curricula. So the theory has 5 components. The first one is the individual, which is the recipient of nursing care. It includes not just the individual per se, but also the individual families. Next one is the health, which is the main purpose of nursing services. Health means total health needs, including healthy state of the mind and the body. Third one is the society or the community, which are included in planning for optimum health on local, state, and international levels. Fourth one is the nursing problem. This includes the client health needs, which can be apparent condition or a concealed one. Fifth one will be problem solving. This includes identifying the problem, selecting pertinent data, formulating hypotheses, testing hypotheses through collection of data, and revising hypotheses. So the sub-concepts of the theory is divided into 4 categories. The first one is the basic needs, maintaining good hygiene and physical comfort to promote optimal activity, exercise, rest, sleep, to promote safety through prevention of accident, injury, or other trauma, and through prevention of the spread of infection. Number 4, to maintain good body mechanics and prevent and correct deformity. Second category is the societal needs. 5, to facilitate the maintenance of a supply of oxygen to all body cells, to facilitate the maintenance of nutrition for all body cells, to facilitate the maintenance of elimination, to facilitate the maintenance of fluid and electrolyte balance, and to recognize the physiologic responses of the body to the disease conditions, including the pathologic, physiologic, and compensatory mechanisms. Number 10 is to facilitate the maintenance of regulatory mechanisms and functions. And 11 is to facilitate the maintenance of sensory function. Third category, remedial care needs. To identify and accept positive and negative expressions, feelings, and reactions. To identify and accept interrelatedness of emotions and organic illness. To facilitate the maintenance of effective verbal and nonverbal communication. To promote the development of productive interpersonal relationships, to facilitate progress toward achievement and personal spiritual goals, to create or maintain a therapeutic environment, to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. The last category is the restorative care needs. Number 19, to accept the optimum possible goals in the light of limitations, physical and emotional. To use community resources as an aid in resolving problems that arise from illness. 21, to understand the role of social problems as influencing factors in the cause of illness.
Here are the 10 steps in problem identification. First is learn to know the patient. Second, sort out relevant and significant data. Third is make generalizations about available data in relation to similar nursing problems presented by other patients. Fourth is identify the therapeutic plan. Fifth is test generalizations with the patient and make additional generalizations. Sixth, validate the patient's conclusions about his nursing problems. Seventh is continue to observe and evaluate the patient over a period of time to identify an attitude and clues affecting his behavior. 8 is explore the patient's and family reaction to the therapeutic plan and involve them in the plan. 9th is identify how the nurses feel about the patient's nursing problems. And lastly, the 10th is discussion, develop a comprehensive nursing care plan. Also, there are 11 nursing skills presented in the theory, and they are 1. Observation of health status. 2nd, skills of communication. 3rd is application of knowledge. 4th is teaching of patients and families. 5th is planning and organization of work. 6th is use of resource materials. 7th is use of personnel materials. 8 is problem solving. 9 is direction of work of others. 10th is therapeutic use of the self. And lastly is the 11th is nursing procedure.
So the theory has also assumptions, and this one includes number 1, the change in anticipated changes that affect nursing, the need to appreciate the interconnectedness of social enterprises and social problems, the impact of the determinants of health on health itself and the healthcare delivery, changing nursing education, continuing education for professional nurses, and development of nursing leaders from underserved groups. So in this theory, the focus of nursing changed from disease-centered to patient-centered, including the patient, care of the patient's families, and also the elders.
Hi everyone, my name is Rashmi. I'm here to discuss the first 5 of 21 nursing problems given by Faya Abdella. We're doing this based on the case scenario we have prepared, and our client name is Mrs. Jones. The first 4 of the 21 nursing problems are basic to all patients. The first one I'm discussing here is to maintain good hygiene and physical comfort. Mrs. Jones seems to be avoiding bath because of bothered by pain in her right toe because of unhealed wound. And the segment, and as a nurse, it is our responsibility to give her bed bath to prevent skin rashes and infection, and change gown regularly. Hygiene is very important. And the second one I'm discussing here is to promote optimal activity, exercise, rest, and sleep. So this is also basic to all clients. In this case, Mrs. Jones is not doing exercises because of pain in her hip, and the client is also not able to sleep because of the pain on the right toe. So it is our duty as a nurse to encourage to do exercise to promote circulation, and do light exercises to promote blood circulation, and the client should be encouraged to do exercise because it also helps to regulate the blood glucose level of Mrs. Jones. The third one I'm discussing here is to promote safety through the prevention of accidents, injury, or other trauma, and through the prevention of the spread of the infection. So in this case, when inspecting, we did not find any signs of infection in any other parts of the client's body other than her right toe. But client is at risk for falls due to vertigo and weakness. So she needs physical support for her activities of daily living from her family members and we nurses to prevent possible fall and trauma. The fourth one is to maintain good body mechanics and prevent and correct deformity. In this case, during inspection of her skin, we did not find any signs of pressure sore in her back or her hip. As a nurse, we have been turning client side to side to prevent pressure sore, and client is encouraged to be on a good posture to maintain a good posture. The fifth one is to facilitate the maintenance of a supply of oxygen to all body cells. So this is one of sustainable care needs. In this
Hi, my name is Vaughn. I'm going to discuss 6 to 11 nursing problems of Faye Abdallah. So the sixth one is to facilitate the maintenance of nutrition for all body cells. So as a nurse, I should know that apart from medical interventions, dietary adjustments to Mrs. Jones' condition is very important. Mrs. Jones is diagnosed with diabetes. Nurse should promote and support healthful eating patterns and maintain body weight goals. Nurse should always address personal and cultural preferences. I will also refer Ms. Jones to medical nutrition therapy for wound healing as she had undergone hip replacement surgery. Referring her for dietitian as well for individual nutritional assessment. And lastly, it is very important for the adherence of Mrs. Jones for the diet to achieve full recovery, and the nurse plays a vital role to fully explain it to her. The seventh nursing problem is to facilitate the maintenance of elimination. To maintain homeostasis of the body, we need to eliminate waste. We need to monitor Mrs. Jones' intake and output every day, preventing Mrs. Jones to experience constipation as well. If a food or drink is not eliminated to the system, it will cause sickness, and we don't want that to happen to Mrs. Jones. Obtaining information in the usual amount of and type of daily fluid intake with particular attention to the amount of caffeine and alcohol and usual dietary fiber and amount of food ingested are important too. C8 problem is to facilitate maintenance of fluid and electrolyte balance. Electrolyte imbalance in diabetes is a primarily result of elevated blood glucose. I'll suggest Mrs. Jones to drink plenty of water, consuming fruit slices such as bananas, strawberries, oranges that can help restore lost potassium. But obviously, we still need to be careful here, and a small bolus may be needed. The best way to get electrolytes into your diet is to eat fruits and veggies. So the ninth nursing problems is to recognize the physiologic responses of the body to disease conditions, pathologic, physiologic, and compensatory. Everyone is unique. We cannot assume that if they have the same disease or symptoms, they will respond to the same. Each one of us has a different response mechanism. Providing holistic care to a patient is very important. It includes emotional, sociological, physical, and spiritual needs of a patient. As a nurse, we should have a thorough assessment of Mrs. Jones because of her surgery. Ask her about her feelings toward the surgery. Is she good? Is she coping? Maybe there's a reason for her fall. Is she dizzy? We should also ask her about what makes her comfortable for treatment. Physical assessment is very important to provide optimum care to a patient. The 10th nursing problems is to facilitate the maintenance of regulatory mechanisms and functions. Facilitating maintenance or restoration of regulatory mechanisms are very vital for a nurse for the healthcare team. For Mrs. Jones' case, as she had undergone surgery, nurse was supposed to provide care for her by giving her medications, wound dressing, oxygen, and repositioning, as well as her diet modification for diabetes. Homeostasis is not merely physiologic, but it includes physical, emotional, environmental, and spiritual. The 11th nursing problems is to facilitate the maintenance of sensory function. So the sensory organs are very important part of our physical body. It is no wonder that Faye Abdallah even included it together with the other sustenance care needs that supports, prolongs, and sustains life. Our sensory organs enable us to see, hear, feel, and smell, and taste. So for Mrs. Jones' case, because of many eye complications due to diabetes, nurse should advise her to get comprehensive dilated eye exam once a year. That this will help her for early detection and prevent irreversible eye complications. Skin aging as well, nurse should advise her to use sunscreen, wearing a hat or sunglasses for UV rays. And lastly, a proper wound dressing for surgery or necrotic gangrene if present to prevent infection. Ang dami kong bakal ba rin?
So I just would like to add some on Vaughn's explanations that during hospitalization, our one goal is to control the patient's blood glucose level and to assess her knowledge about diabetes management. So as a nurse, we can use this opportunity to incorporate health teaching about managing her diabetes, including blood glucose monitoring, taking her medications and the importance of it, dietary requirements, exercise, and also preventing complications that might happen. Next one will be foot care. We can tell her to wash her feet every day in warm water and drying them thoroughly to keep the blood flowing to the feet by putting them up when sitting, by not crossing her legs for longer periods of time, by wiggling her toes and moving ankles up and down for 5 minutes. So for number 12, Mrs. Jones seemed sad and a little agitated. Number 13, from subjective data, staff came to know about her mixed feelings of pain because of her toe wound and her being always tired or fatigued caused by her diabetes. 14, client's speech was slow and was using more nonverbal communication signs, but quite expressive in making her point. Patient looks really tired and sad during the nurse-client interaction. 15, so the patient lives only with the husband. Their children live in a different city and rarely visit the couple. They have neighbors who visit them from time to time, but it's just the two of them most of the time. 16, both patient and husband are Christian. From conversations, the nurses can sense that they are spiritually healthy and is hopeful about their current situation. So interventions and rationales for this is Poonam's part, but unfortunately she has a family emergency that she has to attend to. So the nurse should not make assumptions and be ready for negative and positive response from the patient. According to CNO, 2006, the core of nursing is the therapeutic nurse-client relationship, which contributes to the health of the client and their well-being. If there is a positive trust and respect between the provider and the patient, of course, the nurses can work with the patient effectively. So we as nurses have the responsibility to not just provide medical management of the patient's issues, but also to provide nursing care interventions. So for this to happen, we should have trust, respect, empathy, professional intimacy, and power in our relationship. So as for Mrs. Jones, she didn't trust the nurses initially because of a bad past experience. So we, the nurses, made sure that we keep our promises and to not breach or break the trust that's been already established. In dealing with her sadness and her anxiety about her current health, we did make some time to sit with her and listen to her. So we know that emotional stress can also have a negative impact on the control of diabetes. An increase in stress hormones leads to an increased glucose level. So we can also try to encourage her to adhere to the diabetes treatment plan as much as possible during the time of stress. With regards to her spiritual health, her inner beliefs and expectations affect the client's physical appearance. So the spiritual goals are only achieved when a person has balance between spirit, body, and mind for speedy recovery.
Hi, my name is Anna. To continue with the assessment on Mrs. Jones based on the 21 nursing problems by Faye Abdallah, number 17, to create or maintain a therapeutic environment. Mrs. Jones, as she is at risk for falls, nurse should ensure a therapeutic and safe environment for her, providing a well-lighted room that is free from clutter and obstruction, making sure that all other physical aids to prevent falls are working in good condition, ensuring a quiet and well-regulated room temperature that will provide maximum comfort for her. Number 18, to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. Mrs. Jones expressed her anxiety with regards to her health and physical condition. A therapeutic nurse-client relationship is important to help her develop self-awareness that will help identify her thoughts and feelings and formulate coping mechanisms. Number 19, to accept the optimum possible goals in the light of limitations, physical and emotional. Maintaining an open and good nurse-client relationship, nurse will be able to explore more of Mrs. Jones' feelings and identify her physical and emotional limitations. Work together through her rehabilitation and achieve her maximum function and potential. Number 20, to use community resources as an aid in resolving problems that arise from illness. Mrs. Jones also expressed her concern on self-care. Nurse must help her identify community resources that can assist her in her rehabilitation and activities of daily living, and identify outside resources that will help her acquire the right equipment fitted for her needs. Number 21, to understand the role of social problems as an influencing factors in the cause of illness. Socioeconomic status, environmental condition, occupational, and psychosocial are just some of the factors that attributed to Mrs. Jones' health status and disease.
So in conclusion, Abdallah's theory emphasized that holistic health of the patient is the main purpose of nursing services, which means that nurses do not just implement, or follow doctor's orders, but we also have to implement our own nursing interventions that we can base on the 21 nursing problems. So Abdallah provided these 21 nursing problems and divided them into categories, which covers the whole health aspect of a person, which is the physical, emotional, mental, and spiritual needs. So as nurses, this theory will help us to become more caring nurses in our everyday practice and to actually care about our patient and to have that therapeutic nurse-client relationship all throughout, from admission to discharge.